Teresa here, practice manager. A lot of our patients, the first time they come in, have a lot of questions. So we figured we'd put together some of the most frequently asked questions. What insurances are accepted, and is PT covered by insurances? Most major insurance companies will cover physical therapy. And to find out specifically about your insurance, why don't you give our front office staff a call and we'll be sure to help you out. What should I wear to my physical therapy appointment? Wear something that's loose fitting and sneakers and flat shoes. That'll be the most appropriate. This way the therapist can make sure that they can get a full evaluation of you and get a full range of motion. If you have questions about your home exercise program, a lot of times we're asked, how do I get in touch with my therapist? During the day you can call our front office and we'd be sure to get you in contact with your therapist. But you can also use Vinitial, which is a HIPAA-compliant texting app which will connect you directly with your therapist.
Oh, hello. I'm here to answer some questions from patients. The first question is, why don't I just go to my trainer instead? Well, a trainer has a great place in fitness and trainers work very well with physical therapists. However, physical therapy is more medical based and focuses on injuries, pathologies, pain, and biomechanical improvement to maximize your overall performance with all these activities. Another question patients ask me frequently is, I shouldn't come to physical therapy if I have pain, right? Actually, a major part of physical therapy is pain management. Many physical therapy interventions focus on reducing and even eliminating pain. Some patients ask me, are you going to make me exercise? Well, exercise is a very general term and is different for every patient. Physical therapy exercises range from pain relieving techniques all the way to improving powerlifters techniques with heavy lifting. All physical therapy treatments are based on that individual's capabilities.
What is a pelvic floor physical therapist? A pelvic floor physical therapist is a person with additional postgraduate training in assessment and treatment of pelvic dysfunctions, such as urinary and fecal incontinence, pelvic organ prolapse, and pelvic pain syndrome, such as vulvodynia, dyspareunia, SI joint dysfunction, and coccydynia, which is pain in the tailbone. What is a pelvic exam? A pelvic exam is a combination of looking at external and internal factors of the hips and pelvis which may be affecting the function of the pelvic floor. What can you expect during a pelvic examination? The muscles are assessed vaginally and also externally to allow the therapist to feel the muscles contract and relax. The therapist can also assess for scar tissue from trauma such as pregnancy, birth, surgery, fracture, pelvis fracture, coccyx fracture, and determine between the muscles that are working well and the muscles that need help. Treatment involves identifying the cause of the dysfunction and finding a solution that will work best for the patient. People often ask, what are the pelvic floor muscles? The pelvic floor muscles have been described as a hammock in the pelvis from front to back, and more recently as a trampoline-like structure. These muscles make up the pelvic bowl, which function to support the pelvic organs, assist in urinary and fecal continence, and support the base of the spine. How do we treat the pelvic floor? We treat the pelvic floor in the same way as an injured muscle, such as the hamstring, by manually testing the muscle strength, releasing any trigger points, facilitating a stronger, more efficient contraction, and repatterning the correct strategies, and issuing a home program to return to beloved activities and pain-free living.
One of the common questions we hear is, how often do I need to come in for therapy? Visit frequency depends on the unique needs of each person and is discussed at the first visit. Patients often want to know, how long are my physical therapy sessions going to last? The length of each session also varies based on your needs. Most often they're between 45 minutes and an hour. Another question I commonly hear is, what is dry needling? Dry needling is a specialized treatment using a fine needle to alter the state of muscles. It is used to relieve painful muscles, improve flexibility, and to restore proper function. What can dry needling help treat is another question that I commonly hear. Dry needling can be used to treat most painful conditions. Any condition that involves painful or stiff muscles would potentially benefit from a dry needling treatment. If you have any other questions that we didn't answer, feel free to call the office, or you can check out our website at impactphysio.net. We have a special section where frequently asked questions are answered in more detail.